You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Bill Snyder, who's the CEO of Vivante Healthcare. Welcome to the show, Bill.
Thanks so much for having me on, Dr. Roxy. I'm excited to be here.
It is good to have you here. So let's start off by telling our audience a little bit about your background and what you've been innovating these days.
Yeah, absolutely. So I kind of grew up in healthcare, always been interested in the healthcare space. I spent over a decade at Humana. So it was on the payer side. And back when they had the leadership rotational programs, went through that and really learned a lot. Great organization to work for and a great education on kind of the business of healthcare.
Sure.
But was always, on the weekends and evenings doing entrepreneurial stuff on the side of my desk. So actually worked with a friend, co-created a patient app that we never brought to market, but built it from the ground up and kind of knew that's what I wanted to do, was more entrepreneurial and building things to improve the health of people across the country and across the world. So I ended up leaving Humana and going to a company called Vivante Health out in San Francisco. We were focused on supporting individuals who are suffering from type 2 diabetes at the time. And I led the commercial efforts there and worked a lot with our health plan relationships. But what I'm most excited about is what we're building at Vivante, where our mission is to revolutionize digital health gut first. So working with individuals who suffer from chronic digestive conditions and their related symptoms.
So many people are bringing innovations to market to address the gut. What's going on?
Yeah, I think people are sometimes surprised to find out how big of a problem this is. So 1 in 4 Americans suffer from a chronic digestive condition. So that's a lot of individuals. And this condition set is unique because it is relatively nebulous. The digestive health umbrella or gut health is kind of a big, broad topic.
Yeah.
And under that umbrella, you have stuff like ulcerative colitis, you have Crohn's disease, you have irritable bowel syndrome, you have GERD. So a number of different conditions that are all unique. You also have this big population who are suffering in silence. These things are difficult to talk about. Sometimes it's difficult to access proper care. So it's this big population that really hasn't been supported in the way that they should. And with that comes additional problems. It comes stress, anxiety, quality of life issues. So I think people are catching on and people are understanding the size and scope of this problem. And also the significant impact that it can have on people's lives.
So tell us a little bit about the solution that you've brought to market.
Yeah, so at Vivante, what we're really investing in and building is a platform-based approach. So we're a digital-first organization supported by our incredible care team. And for individuals that come to Vivante, we start with a clinical intake. And so we understand the needs of the member, and we use that information to do 2 things primarily. The first is to assess the risk of the member, because we do kind of work with individuals that are across the gamut. We have folks that have been diagnosed with ulcerative colitis that are working with the GI doc, that are taking a medication, but looking for support in between visits, all the way to individuals who say, hey, I don't have a diagnosis. I haven't seen a provider in a while, but I've got abdominal pain or chronic constipation, and I'm looking for support and care. Yeah. So for us, it's really important to be able to understand the risk of the individual and then build evidence-based clinical pathways that are suited to their unique need, because these are all very personal conditions. And so where we're investing is the ability to leverage things like AI and machine learning to look at disparate data sets and really get good pattern recognition to understand this is what is going to be the best clinical pathway for this individual. And then, so from there, we utilize our technology through app and web platform to provide them with this pathway that ultimately is going to reduce symptoms and get them feeling better. And we support them with historically registered dietitians and health coaches, although next week we'll be going live with adding gastroenterologists and internal medicine specialists to the platform as well. So we can do things like diagnosing, ordering labs, titrating medications, and doing medication review for individuals in need, in addition to all those other components like medical nutritional therapy and cognitive behavioral therapy for patients suffering from irritable bowel syndrome. So it's really the core piece with digestive health is leveraging technology to be highly flexible, to create this personalized experience, which is very much in need in terms of this population that's suffering from these conditions.
So who's paying for this?
So
That's
today,
a $1 question.
yeah, it is a great question, because it's great anytime I'm on a flight somewhere and someone asks me what I do, and I start talking about this great solution that we're building and these outcomes that we're seeing, where we're changing people's lives and saving them money and getting them feeling better, and they're like, okay, I myself, they'll say, hey, I suffer from a digestive condition, or my loved one or my child. How do we get them enrolled? And so today, our method is distribution through employers and health plans primarily. And so we've done a B2B2C approach where we're embedded in the benefits, and that's worked really well for us. We're growing really quickly. We've got an incredible group of clients that we work with today to support their members in need. And that's really caught the attention of national health plans, who have been great partners, and who we're working with big distribution plans on.
So Bill, I think you know that the premise of this show is really having people come on like yourself and talk about that commercialization journey, so other health innovators can learn from one another and have greater success. So let's kind of go back a little bit from day one. What was it like when you first started there as the CEO? And walk us through some of those major decisions that you made in that commercial journey, and what it was like reaching some of maybe those major commercialization milestones.
Yeah, that's it's a great question for us. When I looked at day one as CEO, I talked about three things that we needed to do with our kind of commercial progression and activity. The first was achieve outcomes at scale. So we needed the proof point to be able to go to these self-funded employers and say, hey, we can prove our impact on the individuals we serve. And we did that through a case study that was conservative in nature. We did a 4-to-1 match case scenario. It showed reduction in emergency room visits, reduction duplicative doctor visits, improved medication adherence, incredible patient-reported outcomes. So that was first, is we needed to establish that we were driving real and meaningful change for the individuals we work with. The second was the ability to bill through claims. And so these are large self-funded organizations that are purchasing the solution on behalf of their members. And something that we did early on, which made it easier for them to make that buying decision, was we quickly worked with health plans that were administering their plan. Because we have licensed registered dietitians, we're able to set up a type 2 NPI and bill through the health plan as a medical claim. And that allows those buyers to say, hey, this is coming out of the claims bolus and is part of my total medical spend. So similar to if you're an employer and you're looking at different solutions, you're always looking at the best care for your members and also looking at controlling cost. You're not going to say, hey, this single GI provider in whatever any given state is being added to my network. Let me review them and let me think about them. You leave that to the health plan. And so for us, being able to work with the health plans and being part of that process simplifies the buying process for employers. So now we've got great outcomes at scale. We can bill as a medical claim, so it's easier for those employers to make the purchasing decision. And then the third was going fees at risk and saying, hey, we know that we can impact and control costs, and we know that we have these incredible outcomes. We've proven that, but let's make that even easier for you as the employer, and let's guarantee our work. And so we put together some really robust ROI guarantees on the financial side, patient-reported outcome guarantees. And I think that really spoke to the buyers to say, hey, this is an organization who believes in what they're going to be able to do for our patient population.
So let's kind of start with the first one that you said, the case study. So a lot of times I'm talking to folks and they are kind of just really struggling with this chicken or the egg dilemma, right? I need to have proof in order to get paying customers. I need to get a paying customer in order to get proof, or, even incorporating like piloting in that equation. So what was that situation like for you? And how did you even break through that chicken or egg dilemma to get to that first case study for you to be able to start building some of that proof and that evidence?
Yeah, it's always kind of a unique problem.
Yeah.
And, I've seen people have success with, hey, we're going to do a non-paid pilot and focus specifically on outcomes. I've seen partnerships work where digital health solutions are working with maybe a provider system or a payer for, again, either an unpaid pilot or kind of a discounted pilot. But the idea is we want to publish, we want to show outcomes. For us, the route that we took was we leveraged third-party data initially. And what we did is we went out and said, look, you don't even have to trust us that this is a massive problem. And so we're going to highlight for you. We're going to show you the studies from the CDC. We're going to show you from studies from the National Institute of Health that talk about the prevalence, that show that these are major cost drivers, that show that the impact is not just in your medical claims, but also in your productivity for your employee population. So I think that was building the case for, hey, this is a really, really big problem. And these people have not been paid enough attention to. And so I think that resonated for us early with clients. And so we were fortunate enough to find incredible employers who said, hey, this is a big problem. We care about our members and we want to take the solution to them and see how it works. So we were pretty fortunate there. I think if you can establish that this is a validated problem like we did, we were able to get paying clients on. And part of that was saying to them, hey, we are building this because this was a couple of years ago, and we know what we're doing and how we want to do it. We know what we think we can achieve, but we want to work with you to kind of co-create that a bit. And so that was kind of the deal that we struck early on. Was we were fortunate to have a big paying client where we said, hey, we're going to look at across 21 states the impact we can have on your population because we know we're going to drive incredible outcomes.
So a lot of people ask me, how do I find that early adopter, right? Because not every potential buyer is going to be at that stage where they're interested in something that's not necessarily half-baked, but that they can also help contribute with finalizing what that might look like. And so how did you find that? Was it something that, that you were able to leverage from previous relationships that you had working in Humana or other organizations that you just kind of built up this network? Or was there a more strategic way of identifying who and where they were for you to be able to convert them?
Yeah, so I'll tell you, network helps. You certainly build these relationships over time. And so I'm fortunate to have a great group of innovators from the employer side and from the health plan side who are, I know, to be really good partners and to be innovative. So I will say that certainly helps. But in lieu of that, I think that there's other ways to look at kind of assessing who are those innovative employers. And you can look at different consortiums and buying groups and who's involved in kind of healthcare innovation. And I think you can see those organizations that have done that in the past that have said, hey, we're going to, back when they were piloting kind of these new diabetes solutions and when they were starting to bring better mental health tools to the market, those organizations that said, we want to try this because we think there's something there. That's pretty public. And so I think that's a great for other founders and CEOs to replicate, look at those models, look at who's adopting, and those is where you should kind of really focus your efforts. The other thing is proximity. I will say, if you're a CEO, founder, starting organization in a specific area, if you have an employer that's local to that area, it's a great first step because you can get in front of them, you can build that relationship closely, and leverage that proximity that I think can be really impactful.
Stalk them in person.
That's right.
You heard it here, people. I love it. Okay, so that sounds great. I love number 2, which is have a pathway for reimbursement. I mean, it seems really obvious, but so many people think that that's going to happen through osmosis or just kind of come with time. And I love that you nailed right out of the gate, nope, we've got to figure that out. Otherwise, we have no viable business. And so what are some of those other decisions as you kind of think back on this commercialization journey? Because you've made quite a bit of progress from where you started to where you are today. And maybe just share, what are some of those things that went wrong? Like, let's, kind of keep it real. Like, not every risk that we take is going to turn out. Not every decision or strategic move that we identify is going to happen the way we expect. So what are some of those things that maybe were challenges for you and how you overcame them?
Yeah, I've got a whole, I think, whole hour with mistakes I've made. I think one of the key learnings that stands out, and this is something, we made a bet on introducing hardware into our solution. We went through an FDA approval process. We did a clinical trial with Duke, where the results were published in terms of a novel approach to using a handheld breathalyzer as a monitor of digestive activity. Breath testing is well documented in terms of its ability to diagnose specific conditions in a clinical setting. And so we said, hey, what if this was kind of a paired device? And so we made a bet on that one, it would be impactful for the members. Two, it would improve the longevity of our relationship with our members outside of what we're doing with our application and our care team. And what we found was it was neat, but it wasn't something that was going to really change the impact that we could have on our members. What we saw is we're having huge success with investing in kind of optimization triage and getting patients to the right care at the right time, utilizing our tech stack and the intake process. We're doing great at providing incredible care through this remote care team that does unbelievable work with our members. And so then we had this hardware component that, just wasn't adding much value. It was a little shiny, but there wasn't a whole lot there. So, that was a decision that we went with and we corrected it. We said, hey, this was great, but it was an R&D project. Now we're going to pull it down and we're going to focus on what we do really, really well. And so I think that's an example of, you make decisions with the data that you have at the time, but it's important to then recognize and say, nope, we're going to make a change, and we're going to kind of double down on what we see that's really providing incredible outcomes for our patients.
Awesome. So would you say that as an organization that you guys have reached product market fit yet? Or is that something that you're still working towards?
So we've definitely reached product market fit. And I think that that's seen just from our scale. I mean, we're working with Fortune 100 clients that have launched nationally. We're working with the major health plans. So it's really exciting. And so I think what we've seen is there's a need in the market from the employer and health plan buying side, but then we've also seen there's absolutely a need from the member side, which we kind of knew, but our engagement rates and our enrollment have been phenomenal. So I would say absolutely we've hit product market fit. I think sometimes, for me, I'm always thinking about, okay, but what's next? And so what was unique is I'm talking to our team and I'm saying, hey, everything's great. Our outcomes are incredible. We're having this huge impact on the members we serve. The business is growing like crazy. All of our metrics are up and to the right. Now we're going to make a change. And change is continuing to innovate on the care that we can provide. And that's that we're going to double down on our data analytics, on our machine learning, on getting really, really smart about optimizing that triage. And then we're going to add this new kind of care aspect of adding gastroenterologists and adding internal medicine specialists so that we can do more for our individuals. And we're not going to stop there. We're going to look at how do we simplify the process for these individuals who are suffering. As an example, as we identify individuals, 60% today of individuals who should be getting screened for colorectal cancer screening are having that completed. It's only 60%, so not a tremendous grade for us across the country. So in our next phase of full stack virtual care, we're going to identify those individuals early, and we've partnered with Exact Sciences. We're going to send Cologuard right to the patient's home. So it's nice and simple and easy, and we're closing those gaps in care. And so it's those things that we're continuing that we're really excited about, that we're launching now. So I think for product market fit, while we absolutely have it and things are going incredibly well, I always want to think about what's next. What is kind of the next phase of our business? Because there's just so much opportunity here to improve the care for the members we serve.
So as you were thinking about what next, help us understand whether, is that something that you or your, internal department, R&D department were kind of defining what was going to be that next evolution in your, product or service expansion versus how much of that was really driven by built-in customer demand, and you were just giving them what they helping them solve the new problems that they were already articulating to you. Because I see sometimes organizations will go both paths, where they might build out that product roadmap on their own, and then other times where they're really intimately entangled with the customer that's helping to shape that product roadmap.
Yeah, it's a great question. I think so. You kind of hit on three there, right? It's like my vision, kind of the team, internals,
Yeah.
roadmap, and then customer and partner. For us, it's all three. From the team perspective, I'm really fortunate. We built an incredible team at Vivante, and we've been hiring a ton over the past 18 months, and just across the board, amazing people that are very passionate about this space. So I think that there's a great collaborative effort, sourcing ideas and kind of checking my sanity at times. From then my perspective, I do have my list, I have my whiteboards, and that's what I'm constantly thinking about. So, so sometimes, they've got to rein me in a little bit, and sometimes that it just makes sense and it hits in terms of the vision that I'm casting for where we're going. From the client and partner perspective, we absolutely take that into account. And so this kind of full stack virtual care launch is something that I've always wanted to do. It was kind of a natural progression in terms of us getting to our ultimate vision. I talked to our team about it, had some back and forth discussions, but at the same time, we're looking at the members we're serving. And so we have two sets of clients, right? First and foremost is our members. That's who we wake up thinking about every single day. And so the question, how do we provide even better care? And so it's like, there's some pretty obvious kind of next steps for us. We can do more by being able to diagnose, order labs, doing these innovative lab tests right at the patient's home so that they don't have any access issues. And then the second client is those employers in those health plans. And so for them, there is an element of co-creation. It's, hey, we went out to our clients and said, this is what we're thinking about. And so this is what we're thinking about in terms of evolution. Here's why we think it's going to be so impactful. Yeah. And I think that's a fantastic way to do things, because you get feedback, you get ideas. And I can tell you, we had a great brainstorming session with a partner of ours who's a Fortune 5 company who's been just absolutely incredible. And the way that brainstorming session went was we went down to their headquarters and we said, hey, we're just starting to think about this. What do you think about it? Like, what would look great to you? And we spent an hour asking them questions. And that was incredibly valuable for us. And at the same time, we're always doing our member discussions. What do you want as a member? What do you need as a member? So I think it's a combination of all three for us.
That's brilliant. Absolutely. So you mentioned member engagement. This is something that I think that we have such a long way to go in healthcare in general with member engagement. A lot of times organizations that, might have been successful in overcoming their hurdles of just getting paying customers, that once you have a health plan or an employer that says yes, and you go through that implementation process, how are you, they're not always the best at building awareness and demand for all the new shiny things that they're offering to their members. So help us understand what that journey, part of that journey was like for you all, and how you were able to make that successful, especially when, those organizations have so many different programs that they're trying to introduce to their members.
Well, I think you hit it on the head there in terms of, I think first it's understanding their mindset, right? Mm-hmm. They do have a lot of programs, and they've got people who are wearing a lot of different hats. Yeah. You talk to these benefits teams, they're doing tremendous amount of stuff for their members that they're serving. So I think it's kind of understanding that first and foremost is how do we make it easy for them? And the approach that we've taken is we've built our playbook that we've been able to show with our data. Hey, if you do it this way with us, yep. That translates to X levels of engagement, and then X levels of outcomes and X levels of savings as well. But our message is always, however, we can be flexible within how you like to message to your members. And we can do things like single sign-on. And we make things like security easy for them, that we're SOC 2 certified. And we've gone through all that qualification up front. So our idea is, how do we simplify it for that team? That's kind of the mindset we go in with. And I think when you build that trust with the first clients and the first launches, which our team has done incredibly well, our NPS score on launches is above a 96, and that's NPS on launches for implementation and launching out a solution. We just had a Fortune 50 company comment that it was the best rollout that they've had with any digital health solution was with Vivante. So this is something, and I think it's here's the playbook, but how do you like to do it? Because we can integrate into how your messaging is today. We can do open enrollment. We can be multimodal. So if you like emails, we can do that. We've gone back to the old postcards for some folks, and that's worked really well in their population. And so it's being flexible, but also sharing resources and saying we'll do all the heavy lifting, and then showing what that translates to once you've got a couple of those great launches under your belt.
Yeah. Going back to that ROI. So you mentioned having, machine learning algorithms and AI driven platform for personalization. Obviously, it's a huge topic right now. And, I have people that are asking, well, what are some of those use cases where everybody's talking about AI, but what are some of those use cases where it's actually in place right now and being used and providing some benefit? So help us understand where you are with the rollout of an AI driven solution that's going to drive more personalized experience for those members.
Yeah, I'm glad you asked about this because it's such a broad term and there are totally different aspects of it. And I think it's such an interesting topic right now in healthcare. Mm-hmm. And so where we are is we're on the journey. And so by that, I mean, what we're doing is clinical tags for individuals as they come into that clinical intake, aligning with, hey, we've already got the data in terms of what the best practices are. So what are the guidelines? So think of like rules engine with clinical guidelines that underlay those rules engines that are delivered by our technology. So saying, hey, this individual is presenting with symptoms that could be irritable bowel syndrome. So what we want to do in their pathway is elevate the fact that we have a digital therapeutic, which is cognitive behavioral therapy for patients who suffer from IBS. And we can say, listen, we know that this has been effective in over 70% of individuals who have used some form of CBT to reduce symptoms and get them feeling better. This is a good starting point for you. As opposed to somebody who comes to us and says, hey, I've got ulcerative colitis. I've been working with a GI physician. I'm on this medication. I'm having really bad digestive issues as a result of the medication. Well, hey, let's talk about medical nutritional therapy, where we can identify trigger foods that are maybe causing some of that inflammation. So let's talk about eliminating that and reducing it. So for us, that machine learning and AI algorithm that we're building is understanding each patient's risk profile and then figuring out which is the best clinical pathway for them. What we aren't doing today, we talk about the human touch. We have an incredible care team. And so for us, it's not about using AI to be the care team. It's about guiding individuals and then giving our care team superpowers. So when that member meets the care team for the first time, they're not saying, hey, tell me about yourself. I want to understand what you're suffering from, which we all know happens all the time. And it's so frustrating when that happens. And so our care team, we want them to be able to say, okay, I get it. I know who you are. I know the symptoms you're suffering from. I know what you're overcoming. I know what's been driving some of these issues that you're feeling. Let's dive right in. And so I already have that precursor, so I can be more effective and optimize the time that we have together. So that's the stage we're in terms of utilizing that data across disparate data sets to say, okay, we understand the member. Let's map them to the optimal care. Let's give our care team superpowers so that they can be more efficient in the one-on-one time that they have with each member.
How are you guys either doing it currently or planning to address really like the business model evolution that's built into this personalization? So as you're personalizing care and you've got different pathways, I imagine when you describe that is that different patients are going to need different additional add-ons. And at what point are you deciding that that's part of the package versus this is an add-on and we need another reimbursement pathway for whatever it is that this, patient is needing?
Yeah, it's a good question. And this definitely gets into how you go about billing. For us, we are a case rate model, and that was by design. And because it allows us to complete that kind of total end-to-end care within, for any given patient. And that approach from the market's perspective, has been received very well. And there's a couple different models that are out there that I think work. You have the traditional fee for service where people are billing based upon the interaction with the healthcare system. You have kind of a subscription model with priced up, where it's like access to this model. And then to your point, if you're seeing more care or you're doing more, we're going to add on additional costs. And so for us, we've looked at our utilization metrics, assumed utilization of each patient, because a patient who's going to see one of our gastroenterologists once a month for 6 months, is very different from a patient who says, hey, I can work with a health coach to identify this trigger food, and I want to work primarily on the platform. And so we look at that utilization and say, hey, case rate is going to be a blended rate, because what we don't want to do is say, this individual is so expensive because of their utilization metrics with the providers we're seeing. It's much easier to do that blended rate for individuals. And because of the scale, we can keep the costs low for the total population and for each individual that engages with the platform. And so that's resonated with the buyers, it's resonated with the members we've served and with the health plans. But I do think, the payment methodologies in the healthcare system are always evolving. There's from a legal perspective, from a market perspective, things like risk-bearing entities. We're really excited, as I mentioned before, to go fees at risk. What's interesting, and going back to my contracting days, is who's really set up to take on specific risk, and how do you allocate that risk? I think there's still evolution to go there. So for us, it's great because we can be flexible. We can bill in multiple ways, but with that case rate methodology, that's been really effective for us.
Sounds like it. So as someone who's, worked on both sides, having been an executive at Humana for a number of years, what is happening in the marketplace right now with the we're just have this explosion of innovation that's happening, right? And it seems like it's even on fire right now with all this talk of AI and digital health. What's happening from the payer standpoint, and how is that aligning or misaligned what's happening with the entrepreneurs and startups that are bringing those innovations to market?
Yeah, I think the payers are really evolving in terms of partnerships. And I can tell you, like, our interactions with the payers have been phenomenal. They've been, I think that there's been a focus on, hey, what are the innovative tools that we can clinically validate, that we can, so that they can validate that are improving the health of the members they serve, that are decreasing cost for the member, right? So those folks that are paying out of pocket with their health plans, how do we keep that cost at a minimum? The overall cost, so some of those catastrophic claims, how do we keep folks out of the emergency room, or things like early detection of colorectal cancer screening in our case, I think continue to be a major focus. And then, the other big thing is like access. It's access to care issues. It's really taking a broader approach in terms of those underserved populations, and how do we get more tools to create better care for those individuals as well. That's what we hear from the plans as being significant, and we see it. We're seeing them step up and say, yeah, let's partner with these innovative solutions, and that's been really exciting. I think that'll continue. I think, what they're seeing is innovation, external innovation, and they have some great internal tools as well, but I think that they can look at best in class and in these innovative tools, and that they see the impact that it can have for the members they serve.
So as we kind of wrap up here, what are there any other lessons learned that you want to share with our audience?
I think, one of the things that I always talk about, especially because going back to kind of the two sides of the fence, working for Humana, it's a large public organization, and then I've done startups from the ground up. And one thing that I always recommend in kind of beginning a business and growing a business is to hit that nice kind of medium point in terms of process. And I talk a lot about process across the organization. And you don't want to put in massive process where everyone's like, man, I'm spending my time, filling out surveys or spending all my time on internal work. But I also sometimes I see the kind of view of, hey, we're an early stage company, so we'll figure it out. And I think you need to have like a bedrock of, hey, let's talk about, for us, it's transparency, accountability, and collaboration. And let's make sure that there's a system in place where we have a vision, Now, how do we break that down? Because it's never going to be like this, right? You're never like, hey, I'm going to build this and now my vision is met. It's going to be messy. You're going to take steps, you're going to figure things out along the way. So you take that vision, you break it back to what are our annual goals as a business? Let's build those, let's share it broadly, let's answer questions. Then let's break that into quarterly sprints across the business, not just dev and engineering, but sprints for the organization. And for us, we every quarter we do a full company, 3.5 hours where each business segment stands up and says, hey, in regards to our annual goal, this is what our quarterly goal is. It's red, yellow, green. Red's okay, as long as this is what we've learned and this is how we're adjusting. And so that creates this feeling of alignment. It creates collaboration. And it's accountability because people are putting their name on it, saying, hey, this is what we're going to focus on in terms of meeting our goals. And so that's one thing that I always share is I think sometimes you can have either too much or too little, and it's hitting that happy medium where you have structure in place, process in place that you can build on and allow flexibility and innovation, but it's building that muscle early. I think helps you scale and grow the organization long term.
100%, absolutely. So, Bill, how can folks get a hold of you if they want to follow up with you after the show?
Yeah, so for us, they can certainly, they can find me on LinkedIn, but I'd much rather than find Vivante. So we have our LinkedIn website. We have our homepage as well for Vivante Health, and we'll come up on any Google search, nice and easy. But we'd encourage them to come online, learn more about us, and we'd love it. We never get tired talking about the important work that we're doing. So any opportunity to share more about digestive health and the impact that we can have there, we'd love that opportunity.
Awesome. Thank you so much for joining me today and sharing your experience with us.
Thank you, Dr. Roxy. It was a pleasure. I really appreciate you having me on.
You bet. Thank you so much for listening. See you on the next episode of Health Innovators.